This is ADL number 8, Mobilising, and it begins on page 31 of the nursing document. So we go to our assessment first and we tick whichever applies to our patient. Is our patient fully mobile, restricted, chair-bound, restless? Do they require assistance of 1, assistance of 2? Do they require walking aids? Do they wear splints? And we can document our comment there. Does the patient require manual handling? Yes or no? And we can document our comment there. So please complete the Safe Patient Moving and Handling form on page 32, and I'll go through that in a minute. So we'll go over to Care Plan 8A. So if we identify that there's any issues with the patient's mobility, we will activate this care plan. So the nursing diagnosis is impaired physical mobility. The expected outcome is that the patient achieves optimum activity level. So the nursing interventions: instruct patient to use call bell when needed, place belongings within reach, liaise with physiotherapist, use as appropriate aid, so you can put in whatever it is there, liaise with occupational therapist, manual handling equipment not to be left underneath the patient, encourage ambulation with assistance or supervision, encourage leg exercises while in bed or chair. In case of stroke, support weak side to prevent subluxation and dress affected side first. Encourage patient to get dressed. And you have blank interventions here, so you can make it individual for your patient and document your own interventions. The next part of the Mobilising care plan is your DVT and PE risk assessment. So here are some risk factors for DVTs and PEs. If the patient is post-op recovery, if they have a previous history of DVT or PE, if there's a family history of DVT or PE, immobilization, stroke, if they have a plaster of Paris in situ, and then other. So activate Care Plan 8B if any risks are identified. So Care Plan 8B, heightened risk of DVT or PE, the expected outcome monitored for development of DVT and preventative strategies implemented. So you can activate your interventions here. Observe for signs of DVT such as warmed, reddened skin, pain in calf, thigh, pyrexia, increased calf measurement. Observe for signs of PE, dyspnea, plus or minus tachycardia, pyrexia, chest pain and hypoxia. Liaise with medical or surgical team if above signs are observed. Encourage mobilization with assistance or supervision. Encourage deep breathing and leg exercises. Encourage adequate fluid intake. Administer anticoagulants as prescribed. Anti-embolic stockings applied as prescribed. On page 32 then we have our nursing assessment for the Safe Patient Moving and Handling assessment form. So assess patient on admission, reassess if changing condition or otherwise weekly. Relieve any pain before assessment. Using the table below, please circle appropriate answer in each category to allocate a score to the patient. Accumulate the score to give a total assessment score. 6 numbers represent 6 separate assessments. So we look at each aspect here. So we look at the patient's weight first. So we circle which one applies. If the patient is less than 50 kgs, they'll be scoring a 0. So we circle a 0. If they're between 51 and 76 kgs, they score a 1. So we circle a 1, etc. Okay, and then we go to the behaviour. Is the patient fully cooperative? If they are, they score a 0. If they're comatose, they score a 1. If they're confused or unable to understand, they score a 2. If they're agitated or aggressive, they score a 3. Mobility then, if the patient is independent, they score a 0. If they require minimal assistance, they score a 1. If they require moderate assistance, they score a 2. If they are dependent, they score a 3. Changing or transferring position, if they can do this unaided, they score a 0. If they require 1 helper, they score a 2. If they require 2 helper, they score a 4. And if they're dependent, they score a 6. Weight bearing, if the patient is fully weight bearing, they score a 0. If they're partial weight bearing, they score a 1. If they're non-weight bearing or dependent, they score a 3. So total scores, add constraint score and insert into box below. So you add up your scores, and then for each applicable constraint from this list below, add 1 to your score. So if 2 constraints apply, then add 2 to score, etc. Utilize score indicator to guide equipment selection. Okay, so if your patient is after having abdominal or cardiac surgery, you add another 1 to your score. If they have tubes or drains in situ, you add another 1. Okay, etc. So you get your total score, you put in your date, the score, the initial, and then here you have your care plan. So depending on your score, if the patient is scoring between 0 and 3, they're considered low risk. Possible aids required to assist with manual handling. If the patient scores between 4 and 13, then they're medium risk. So it tells you to consider previous and following equipment: slide sheets, transfer board, one-way slide, handling belt, turning disc. So you can tick whichever one you're going to use for your patient. And if your patient is scoring 14 or more, then they're high risk. So then you may also consider this equipment here as well. So electric profiling bed, hoist, sit to stand, hoist, lifting, and pat slide. So you tick whichever is relevant. And just a note here, if your patient is greater than 25 stone, or if they have a BMI of greater than 35, then seek manual handling advice and consider the use of your bariatric equipment. Okay, so there you may discuss with the multidisciplinary team, the physiotherapist, the occupational therapist, in relation to what equipment may be suitable for your patient.